Hello, my name is Tasha Riggs with HealthMarkets, and today's question is, my diabetic medication is super expensive. I have heard horror stories about Part D drugs or Part D not covering what people need. Should I get a standalone Part D or get it through Medicare Advantage? Well, I really don't know how to answer that question unless I know exactly what diabetic medicine you're taking, because I will look up your diabetic medication in this system and figure out which plan will be best for you. Now, the Nuvalogs, Humalogs, a lot of those, especially if you're just doing the basic injectable, not the Solo Star pins, but just needle, bottle, those are super inexpensive. You can get a lot of those for just $35. They're not all that expensive. When you get the Solo Star pin, those are pre-made for you. You just click it, inject it. Those are going to be a little bit more expensive. When you start taking, I don't want to call it designer, but like a lot of the drugs that are helping type 2 diabetes, which is more the Ozempic and the Mounjaros and the GLP-1s, those will be expensive. If they're being used for diabetic reasons, yes, they could be very expensive. To make them, they're very expensive. If you are using it for weight loss, it will never be covered. I don't care what insurance you have. If it's being told that it's being done for weight loss, it will not be covered. But if it's being used for diabetes and your doctor can verify that it's being used for diabetes, then yes, there are some plans that'll cover it at $47. With that said, I would really need to know what drug you have, the milligrams, so I can do a database search to figure out which drug plan would be best for you. Now, you ask whether I should do a standalone drug card or a Medicare Advantage. You will find Medicare Advantages will have a lower cost on a lot of the drugs when I run them. And that's probably because the health insurance and the drugs are all rolled in one, so they could, get their loss ratio across the whole cost of the whole plan. Where if you have a standalone drug card, it's a standalone drug card. They can't take their medicine losses and spread it out through a healthcare plan. So a lot of times standalone drug cards are more costly, premium-wise per month, and the cost of the drugs a lot of times are more expensive because there's nowhere to share the loss in the cost of the drug. So that's why you'll find Medicare Advantages will have, most of the time if you run them side by side, you'll find a lower cost in a Medicare Advantage.